Speaking of movies, Will Smith is in a movie in theaters right now called Concussion. The topic of head trauma has been a hot topic from grade school athletes all the way to the NFL. So we talked to a doctor about what signs parents should be looking for when it comes to concussions.
The CDC estimates that as many as 3.9 million sports-related and recreation-related concussions occur in the U.S. each year. And now that number may actually even be higher because more concussions are not actually diagnosed correctly. Even with all the recent attention on concussions, how much do people really know about how to spot a concussion, what to do about it, and how they are treated? In fact, many people don't even know how a concussion is even caused. So to get answers today, we are talking to neurologist Dr. David Dodick from the Mayo Clinic right here in Arizona. Doctor, you're right up the road in Phoenix. I'm so glad that you're having a moment to stop and talk to us about this because, like we were saying, it is a really big hot topic out there. But I'm going to ask you a really basic question. What is a concussion?
Well, Tina, concussion is really an alteration in the way the brain functions as a result of an injury to the brain, usually, but not always, caused by a blow to the head. And that alteration in the way the brain functions can manifest itself in a variety of different ways. So the athlete could report headache is probably the most common symptom, but other symptoms include an unusual sensitivity to light, to noise, troubles with balance, difficulty with concentration, maybe a change in mood or behavior, sometimes a sleep disturbance. They either sleep too much or they can't get to sleep. So there's a variety of different symptoms that may manifest as a result of that brain injury.
So, doctor, is that why I was saying just a moment ago that some concussions are not diagnosed correctly? Is it because the symptoms are so varied?
Yes, well, it's not always obvious to an onlooker that a concussion has occurred because many of these symptoms that occur have to be reported by the individual. So if an athlete is staggering or lost consciousness, or can't get up off the field for a period of time because of a blow to the head, that's relatively easy to spot. But if a hit occurred that may not have even been recognized because it occurred away from play, for example, then the headache, if the athlete's experiencing headache or sensitivity to light or noise or a little bit of dizziness, then the athlete may not report that, either because they don't want to report it or because they don't even recognize it as being a concussion. So to an onlooker, if there are no visible signs of a concussion, if the athlete's experiencing those symptoms, we really rely on the reporting of those symptoms to detect a concussion.
Well, now, if I'm a coach or a parent or a friend or somebody that may feel like some of these symptoms are occurring, what's the first thing we should do if we think a concussion has actually happened?
Isolate the player. Take them away from the game. Isolate them either on the sideline or ringside or preferably in a quiet place and do an evaluation. That evaluation usually consists of a test of balance, a test of eye movements, and a test of cognition. So we look at their ability to concentrate and to remember. Usually, though, we have to have a baseline assessment of how their brain was functioning and how they performed on those tasks before they even started to participate in the game or before the season, preferably, so that we have a baseline or a comparison, if you will. So when we evaluate a player, we need to know what they look like before the game and before the season to be able to compare, to know whether or not their brain is not functioning properly.
Well, doctor, like you said, the most important thing that we take out of our discussion right now is that players, whether it's, teenagers all the way down to the young children, if you feel like you're having those symptoms, you have to report it and you have to let somebody know that you're feeling that way. So that's why it's so important we're having this conversation. So I want to thank you once again for stopping in and talking with us.
My pleasure, Tina. Thank you.
Now, don't go anywhere. The Morning Blend will be right back.